Quarters.
Welcome back to San Antonio Living. Well, hair thinning and hair loss is very common. It's a subject we care about, but we don't exactly talk about it. Well, there's a new cutting-edge treatment at the Institute for Women's Health that not only restores your hair, but helps you grow new, healthy hair. Take a look. Is a common problem, and it's often something we don't talk about. The good news is over at the Institute for Women's Health, it is something that is being treated. And with us is Dr. Wendy Askew. How are you, doctor?
I'm great, Claudia. Thanks for coming out again. We're so excited to tell everybody about our new treatment.
Absolutely. You know, hair loss is something that a lot of people face. It can be a little bit embarrassing, and it's a big deal. But
absolutely. It's a very stressful problem, and people don't realize how common it is. New estimates by the American Academy of Dermatology estimate that over 80 million Americans suffer from thinning hair. And they say that 1 out of every 2 men and 1 out of every 3 women suffers from thinning hair. And it's not really just a cosmetic problem. It has such harmful effects on people's self-esteem, how they feel about themselves, how they interact with others based on it. And so there's kind of a lot of different causes and kind of limited treatments. And we are super excited to be able to offer one of the best available treatments, and FDA-approved treatment for thinning hair in men and women. This is something that it's a Sonetics laser, low-level laser light therapy, and it utilizes a very low frequency of light wave in the red spectrum of the visible light field that has been clinically shown to help restore and heal damaged hair follicles in the scalp. And this simple unit, all it requires is people to come in and do 2 20-minute treatments a week for the first 12 weeks, and within that time frame, you will start to get repairing of the damaged hair follicles and start to see a decrease in the shedding and the hairs that are being lost every day. And then beyond that, you start to see new hair growing from it. And wonderful also, the hair that grows tends to be thicker, tends to be stronger, and tends to be more resistant to breakage.
Yes.
So the before and after pictures with this device are amazing. The recommended duration of the therapy is a 1-year therapy. And the first 12 weeks, you come twice a week. And then the next 12 weeks, you only come once a week. And beyond that, you only come once a month for 6 months. And then they do recommend afterwards, if you're happy and really experiencing renewed hair growth and improvement, that to consider doing continuation of therapy at once a month for another year. But people see results really quickly.
Is there any risk involved at all?
There are essentially no risks. This amplitude of light has no burning effects, no harmful effects to your eyes, to your skin, to anything like that at all. I mean, there are basically no risks associated with it. So very safe, very simple. It doesn't hurt. When you're sitting under it, you can't feel warmth or anything. You just sit for 20 minutes. You don't even need to wear eye protection. It's so safe.
That is great. Now, ladies, and we're also talking to the men when it comes to hair restoration. This is for you. Don't think about it twice. Come on over and help yourself get that hair that you've been needing, because this is going to help you.
Absolutely. We may have to change our name to the Institute for Men and Women's Health, because this is absolutely designed for both men and women. If you've already gone fully bald, this is not a miracle worker. But for those who are just experiencing thinning, this may really change your life.
That is awesome. Well, thank you so much, Dr. Askew.
Yes, of course. Thanks.
Hair loss doesn't have to be a problem, ladies and men. Come on over to the Institute for Women's Health and ask about their hair restoration treatment. Now, this is the Institute for Women's Health. They're on Hardy Oak Boulevard, Suite 230. Give them a call, 494-2000. Online, ifwh.org. Find them on Facebook and Twitter at IFWHSA. All right, everybody.